Good afternoon. Welcome to this instruction course on decision making in RRD repair. I am Dr. N.S. Muralidhar, Chief Instructor for this instruction course. So I thank the organizers of All India Ophthalmic Committee for accepting this instruction course. Now, rhegmatogenous retinal detachment is one of the most common surgeries that retinal surgeons would be called to perform. And when we have a patient with retinal detachment, we are faced with many choice of surgeries. And in each surgery, there are many steps requiring decision making. And many such decisions are honed by long years of experience. So this instruction course is an attempt to transfer some of the decision making skills that the faculty have acquired over long periods of experience as vitreoretinal surgeons. Now, when we have a patient with RD, we have a plethora of choices. We can do a pneumatic retinopexy, we can do a scleral buckling, we can do vitrectomy, and we can also do a combined buckle vit. So which one do I do in this given patient? How do we decide? So which patient is a suitable case for pneumatic retinopexy? Which gas should I use when I do pneumatic retinopexy? Should I do cryo in this patient, or should I do laser in this patient as a two-step procedure? These are some of the questions that comes to our mind. These are some of the decisions we have to make when we are faced with pneumatic retinopexy. When it comes to scleral buckling, the number of questions increases. Should I do a segmental buckle only, or should I do an encircling also in this patient? Should I do a radial buckle or a circumferential buckle? Of course, the age-old question, should I drain or not drain? And if I have to drain, where should I drain? How do I drain? Should I do a chandelier-assisted scleral buckling that people talk about these days? So these are some of the decisions we need to make when we are confronted with a choice of scleral buckling. So when it comes to vitrectomy, again we have so many choices. Should I add a belt buckle along with vitrectomy in this patient? Should I use PFCL for flattening the retina in this patient? Should I do a 360-degree laser to the retina in this eye? Should I use... I will announce. So should I add a belt buckle? Should I use PFCL? Should I do 360-degree laser? Should I use gas? Which gas should I use? Or should I use silicone oil in this eye? If at all you want to use silicone oil, which oil should I use? Should I use 1000 centistokes? Should I use 5000, 2000? So should I peel the ILM or not? Everybody is talking about peeling ILM in all the situations. Should I peel ILM or not? So these are some of the decisions that we need to make when we are doing a vitrectomy. So over the next 50 minutes or 70 minutes, we have an expert panel to answer or to help you make some of these decisions. So I will introduce each of the speaker as they make their lecture, but the faculty day consists of, apart from me, Dr. Guru Prasad, Dr. K.S. Kumar, Dr. Naresh Kumar Yadav, Dr. Hemant Murthy, and Dr. Pramod Bhende. So without wasting much time, I call upon my first speaker for this session, Dr. Guru Prasad, to give his lecture. While he is coming and getting his presentation ready, it's my very pleasant duty to introduce Dr. Guru Prasad. Most of the faculty do not need introduction, but for the sake of completion, Dr. Guru Prasad is the vitreoretinal surgeon, head of the vitreoretinal department at M.M. Joshi Eye Hospital, Hubli. He has done his graduation from Bangalore Medical College and post-graduation from Karnataka Institute of Medical Sciences, Hubli, and then surgical training in retina eye from Shankara Nethralaya. He is a prolific vitreoretinal surgeon, and he is also a very good phaco surgeon. And I would rate that he probably has done the maximum number of retinal surgeries in amongst all of us, because Hubli, being in the northern part of Karnataka, is one of the main centers where vitreoretinal surgery was being done for a long number of years. He was the only retinal surgeon available in that part of the state, Karnataka state, and he has vast experience. He's an experienced surgeon, an excellent clinician, and a very great teacher.